You are welcome to my channel. Thanks for visiting. I'll be addressing supplemental oxygen use in COPD patients. The question is, do you really need more oxygen? Because many COPD patients and their relatives will continue to be pestering nurses and doctors to give more and more and more oxygen. And also, is it appropriate for us to keep giving more and more oxygen to COPD patients? Without further ado, let's go. O2 sat between 88 to 92% is okay in anyone with COPD. Respiration is dictated by the level of CO2. And what will happen? The central chemoreceptors will detect the high level of CO2 that will be presented by the value of pH that will be low, respiratory acidosis. So, a high level of CO2 is expected to increase the respiratory rate. But in COPD patients, they will rely more on oxygen receptors and less on CO2 receptors. So, increased oxygen will mean less respiration. I will explain further. Now, the further explanation. When CO2 increases, there will be trigger for increase in the respiratory rate in normal condition. Increased CO2 will lead to low level of pH, which is acidosis. And that is what the central chemoreceptors in the brain, particularly medulla oblongata, will pick or sense. Then, being the higher center, the medulla oblongata will send instructions to the peripheral chemoreceptors. But in COPD patients, that has become the norm every day. So there is fatigue, in picking info as a result of high level of CO2 giving us low pH, and then medulla oblongata will be sending info to peripheral chemoreceptors is already weakened. They are tired. They've been getting this all the time. So it's fatigue in COPD patients. That should be the normal thing in every other patient, but in COPD, it's no longer the way. Now, since CO2 level and low pH is no longer driving the rate of respiration, the COPD patient will resort to hypoxic drive. It's like the keys are in the vehicle, the mom and dad are driving, and at the point, neither the mom nor the dad could drive, and then they've not reached the destination. One of the kids who could drive is now taking over. By the way, what we are concerned about is getting to the destination. In this case, all we want is for oxygen to get into the blood and get to the tissue. Now, COPD patients will still have the privilege of resorting to hypoxic drive. So deviation from the norm is occurring in COPD patients with chronic CO2 retention. Direct stimulation from central to peripheral chemoreceptor has become fatigue, or we can say tolerance has developed. So I want all my friends, the people that I've known, those that I've not known, and anyone listening here to help anyone with COPD, because it is not their fault. They did not choose to have this. It has happened, but this is the physiological basis of the level of oxygen that you need. So the hypoxic drive takes over. And what will happen? Decreased oxygen is what will now be driving the rate of respiration. Then the balance could then be reached and will be fine at anything 88 to 92, or if we are lucky enough to get 94% O2 sat, that is great. Now, in conclusion, we have stated that 88 to 92% O2 sat is fine in anyone with COPD. So, when we then start disturbing the nurses, the doctors, like, oh, give more oxygen, my neighbor is taking so liters every minute for so period of time. Do you have the same diagnosis? Let's go through this conclusion together. Oxygen to be given to maintain balance is good in COPD, but we should be careful. We should not give it for too long, and we should not give too high level of oxygen in a bid to have more saturation, in a bid to have more O2 sat. Don't let us keep COPD patients on high level of oxygen for too long. Once we're able to reach 88 to 92% O2 sat, we are fine. Why that? Too much oxygen for a long time in a chronic CO2 retention or COPD patient, that will be detrimental. That may even kill the patient because we will cut off the hypoxic drive. More oxygen, less respiration in COPD patient. Once we're able to achieve 88 to 92, we're good. Thanks for listening. I hope this will make sense and reduce argument between family members, loving ones, concerned ones. I appreciate you, but this is the physiological explanation. Please subscribe to my channel. I appreciate that.